These are very secretive in nature, eating disorders, and they can be embarrassing and they can be an identity. So how do you get buy-in for them to engage in treatment?
I have like the benefit of using objective information. So the data that I collect, like whether it be vital signs or lab work, or an EKG, those are objective information. And so sometimes when you present those to the client, it makes it difficult for them. It kind of brings them out of like their head and kind of into what's going out in front of
the
them.
reality of what's happening.
Yeah.
I think that from like research I've done and like readings I've done, I love to throw statistics at people and like numbers. I think that can be really helpful. Like when I have someone come in and they're eating, a really low calorie amount, I like to, say like 1,200 calories is what a toddler needs in a day, not, a full grown person or like a growing teenager and that kind of thing. But I think a big piece of like what I do is that building rapport. Like I try to really build a relationship with them, and I see mostly teenagers. So like trying to really build that relationship and that trust, and then, pointing out like, what do you think it would be like if you didn't think about food all day, right? Because oftentimes they're thinking about food, not necessarily eating it, but like, how am I going to avoid eating it at the next time? Or, if I eat this, like, what's my opportunity to purge afterwards? All that kind of thing. So just pointing out like, do you know how much more brain space you'd have if you didn't think of food all day long? So
that's a lot of time and energy.
Yeah, and those scary statistics are like, I think they're really impactful too. And like when I pull out the information that I have and like warn them of what could be in the future, it doesn't always hit, because sometimes there's that aspect of like, oh, I'm not that sick, like whatever, it's not going to happen to me. But a few times you really can see like the look set in on like the patient's face and kind of see it like hit a little bit. Doesn't mean that actions are going to occur that day, the next week or whatever, but by planting those things, I think over time it can kind of help. And it also helps a little bit with parents too. Yeah, I think it can help parents kind of focus and hone in and like help their child the best way they can in terms of like, well, for like doctor's appointments or like things like that, and making sure that they hold them accountable to like the recommendations their therapist or nutritionist, dietitian has.
A thing that I have heard quite often is this from therapists. They have, and other providers, they say, the provider will say this child needs a more intensive level of care, and they'll say, I need to have the parents buy in. I've heard that a lot, where they say they're okay, they'll be fine. So I love hearing that you can give some statistics and kind of the reality of where it could be headed.
Right. Yeah. And if parents are like, oh, well, they say they're fine, like they don't want to come as often, we want to decrease appointments, this might be like a really big thing, but I say if your child had cancer, you wouldn't let them miss chemo. Let's not let them miss therapy. So
that gives me chills, because it's true.